you mentioned in a tweet recently that Stampede was the first major event to happen in Canada after the pandemic, and how several health experts have spoken out saying that the pandemic is not over, and that's a little bit of mixed messaging coming from the province here. So we are not yet into an endemic stage. Do you stand by those comments that the pandemic is over, or is that maybe a little bit premature?
Well, as Dr. Hinshaw has said, we are moving from a pandemic to an endemic state of COVID-19. We have seen the numbers come down dramatically in Alberta. We should salute that. You know, I think it's time, let me be blunt, I think it's time for media to stop promoting fear when it comes to COVID-19 and to start actually looking at where we're at with huge vaccine protection. We have crushed that third spike. COVID continues to exist. As I've said before, the virus will continue to circulate. Numbers will go up and they'll go down. But what matters most is that the widespread protective effect of vaccines is real. We should embrace the science. We should stop listening to people who deny the powerful protective effect of vaccines. What we've seen around the world is that countries with high levels of vaccine coverage across their population have decoupled cases from hospitalizations and fatalities. We never had restrictions in the past to stop people from getting few or no symptoms. They were there to protect the hospital system, the healthcare system, and prevent large-scale fatalities. So yesterday we had 0 COVID fatalities. We now have fewer people in hospital with COVID-19 than at any point in the past 9 months. Today, we will achieve 75% first dose protective coverage of the eligible Alberta population. Within a week, we'll hit about 65% fully vaccinated amongst the eligible population. But most importantly, about 90% of the vulnerable in Alberta have been vaccinated. That is people over the age of 65. Those are by far the most vulnerable individuals. And that means that when COVID case numbers go up, as they will at various times in the future, they will not represent a significant threat to our healthcare capacity. And so that's why our chief medical officer provided advice to drop virtually all public health restrictions once we achieved the thresholds back in June. And I'm very encouraged. We're now 3 weeks into that full openness, and I'm very encouraged to see that we continue to do very well. Now, there's no doubt, as I've said before, case numbers will go up in the future, but that should not lead to the same kind of response. There will be a residual individualized risk for some people. Some people will contract COVID. A small number, much smaller percentage of those people than before will be hospitalized, and a much smaller percentage than before may pass away. But that is true of other diseases that we contend with all of the time, like the flu influenza. So I believe that we can move forward with confidence, of course, using some common sense about basic hygiene and staying at home if you're sick, things like that. But we are very confident about the plan for Alberta to be open for as we've done through phase 3.